And so today we're gonna talk about behavioral health, and we're gonna kind of dig a little deeper than I think what has maybe previously been discussed at different times in the conference and in your other kind of times in learning about this line of work. But when we talk about the behavioral health population, we're generally talking about those that have mental health and substance use needs. But I think it's really important to highlight and to underscore that trauma is a big piece of addressing the complex needs of those individuals. And so we're gonna focus primarily on trauma and how it relates to those with mental health and behavioral health needs. When I was a social worker, when I first began my social work career at the Red Hook Community Justice Center, we made a concerted effort to talk about trauma with our clients and to assess for it, and we added questions into our assessment process. And again, many of you have been at Red Hook, but these were cases that Judge Calabresi, who I don't think is here right now, but these are cases that Judge Calabresi had mandated, had ordered to speak to the clinic to get a clinical assessment. And so it was during these conversations that we would ask about trauma, and clients or participants would look at us perplexed, not because they didn't understand the question, but because they could not believe that somebody working within the criminal justice system would ask about their trauma history. And we quickly also realized that trauma didn't just go to kind of understand interpersonal trauma, but it extended to include systemic and community trauma. And that was kind of a really powerful moment for us to understand how deep the issue was. The National Center of Trauma-Informed Care states, and I quote, that the experience of trauma among people with substance abuse and mental health disorders, especially those involved with the criminal justice system, is so high as to be considered an almost universal experience. Think about that, an almost universal experience. So what does that mean for us as practitioners? Why should we care about trauma? And what exactly is the peer advocate model? And can it help us understand and address the complex needs of trauma survivors in the criminal justice system? So these are those are some ambitious questions, and I'm gonna be ambitious and try to help us untackle some of those questions. And I feel, as I mentioned, I feel honored to be sitting next to the company of these great folks right here. So let me quickly introduce them. First, to my left, we've got Kenton Kirby, who is the Director of Clinical and Trauma Support Services at the Crown Heights Community Mediation Center in Brooklyn. He's also one of the founders in developing and implementing the Make It Happen program. To his left, we've got Antonio Hatch, who is a forensic mental health evaluator for the Behavioral Health Justice-Related Services Unit in Philadelphia, where he completes on-site mental health assessments for the city's Accelerated Misdemeanor Program. And I should mention that this unit was expanded to include the mental health population for cases as part of the 2016 Community Court Grant Program. And last but not least, to his left, we've got Laverne Miller, who is a Senior Project Associate with Policy Research Associates. Ms. Miller is the lead on peer-focused activities at the SAMHSA's Gain Center for Behavioral Health and Justice Transformation. Ms. Miller is the former director of the nationally and internationally recognized Howie the Harp Peer Advocacy Center in New York City. While leading Howie the Harp, she developed the first training program to prepare justice-involved peers to work in the criminal justice settings. Ms. Miller also previously served as an assistant district attorney in New York County. So, with all of that good stuff out of the way, let's just jump right in. Kenton, I'm going to ask you to kind of kick it off for us. Tell us, why should we care about trauma in this context? Trauma is a buzzword these days. So tell us, why should we care?
Okay, so why do we need to care about trauma when we're doing this work? Basically, I'll start with this. even as service providers in these systems, in the courts, we also have caused harm, and we have to acknowledge that we are part of that trauma experience for the people that come in front of us. So it's important because we are part of that. We are part of that problem for the people that are walking through our doors, our courtrooms, our clinics, and it's important for us to think about trauma because we have to have a wider lens in how we define what trauma reactions are. Someone who, typically you look at someone who's experienced something directly, or harmed themselves, you're like, oh, that's the person that's been harmed. What about the person that actually has caused the harm, right? We don't offer that humanity for the person that caused that damage, right? But at the end of the day, there's a lot of mantras that hurt people, right? So we must allow space for people who also have been on the other side of the harm to also have the opportunity for healing and redemption. And I feel it's important that we integrate trauma into our work because we need to have a wider lens because that person is in front of you, standing in front of you in the courthouse, for whatever that isolated incident was, there's so many other things that took place that where they were harmed. Honestly, let's be honest, if we are recognizing people's humanity, and we're not saying people are monsters, if someone causes harm or shoots someone or does something else, I can imagine that must be extremely a life-changing moment too, right? So I say considering trauma in our work is only going to help us really kind of bring humanity into the work that we're doing with our clients.
So, Kenton, that there was kind of a lot in there, and I guess I'm wondering. So, I think that many of us can agree that the court generally assigns roles to people, right? We've got the witness, we've got the victim, we've got the defendant. Kind of, how does that work, and what's your take on that? And also, what are trauma symptoms? What do trauma symptoms look like?
Okay, so when I think of the different roles people play in the system, victim, defendant, respondent, whatever language you're using, the problem with that is it ends up following them throughout the course of their time in our systems, right? But at the same time, I understand we have to put people in buckets to kind of figure out how best to serve them or how best to punish. For me, I look at trauma symptoms from a wider lens. Someone who is aggressive, right, for whatever reason, walking around with a weapon or something. And I'm speaking around this stuff because of the work that I do in Brooklyn. I work closely with the Cure Violence site. Then we work with people who are closest to gun violence. So I just want to throw that out there and make sure everyone understands where I'm coming from. People who are making decisions to carry a gun, for me, that's a trauma reaction. Because you didn't make the decision to carry a gun because you're a monster, right? What happened to make you make that decision? What about your life experience that you don't feel safe enough to carry a gun or carry some sort of weapon or walk around where you're hypervigilant? If you think about it from trauma, like that's hypervigilance, right? But we don't offer that space to someone who makes a decision that we deem immoral, right? So that's kind of how I look at trauma reactions, and how a lot of times the decisions that the young men that I work with make are not looked at as trauma symptoms as opposed to just criminal behavior. And while it is criminal behavior, you're not allowed to do those things, you should also understand what made them make that decision.
So this idea that the people in front of you that maybe have committed a crime are also victims of trauma.
Exactly.
And can you tell us a story about how you've seen this kind of play out?
Okay.
In your work?
So I've been at CCI in the Mediation Center for about 4 years, and I remember I was working with this young man who was mandated to a program because he had a gun charge. He was known to be involved in street organizations. He's had a number of violent arrests, and he was mandated to this program, and he was making progress. As he's walking out of his program, 2 or 3 people he had conflicts with knew where he was going to be at, so they followed him from the program. Get on the subway, he's riding the subway home, and when they get to their community, they stab him on the subway and leave him to die. He survives. 3 weeks, he doesn't have to go to court, shows up to court, and the first thing the judge says to him is, "What did you do?" As opposed to, are you okay? And that right there is hugely problematic because you're already saying that because of that isolated incident that brought you into this court, that brought you into this mandated program, your humanity is less than anyone else's here. As opposed to, what did you do, as opposed to, are you okay, young man? I can imagine that that must have been a scary experience for you. How can we figure out, how can we keep you safe? None of those things were offered to him. And so this is a perfect example of why we need to really have a wider lens when it comes to trauma experiences, trauma reactions, for people who are the traditional victims and those who are the non-traditional victims, you know? So that's kind of, that story right there is very glaring for me as to why I need to continue the work I'm doing around kind of expanding trauma understanding.
So I think that really clearly illustrates, especially in the courtroom, how there's this misconception, if you will, about particularly on the interpersonal trauma, but also how the community trauma plays a role in how somebody's being, presenting or being in court, and how a system, the criminal justice system, can almost re-traumatize a person that's been traumatized, right, in the community. So I want to turn to Antonio, actually. And so you're in the courtroom day in and day out in Philly. So I guess give us a sense of what that is like, particularly about how you see people coming in that are trauma victims, and what they're presenting with, and some of the tactics that you use to de-escalate them when they're coming into the courthouse.
Okay, good morning, everyone. Well, Philadelphia is unique in its own right, number one, just like every other jurisdiction. But the one thing that I recognize immediately from everyone coming into the courtroom is that I was in that place at one point 23 years ago myself. And I recall how I was stigmatized and how I was treated. But the one thing that helps me with my de-escalation tactics is relativity. You understand that in order to solve a problem, you have to always start at the beginning. You know, it's the same as a math problem. You miss a step, you have to start the problem over again. But when you understand that most people don't just wake up in the morning and say, I'm just going to go commit a crime today. So my de-escalation tactics is understanding, looking at these guys and feeling exactly where they're coming from. On many occasions, a lot of our defendants' clients come into court, they're under the influence. How do you recognize these things unless you certain things books just don't teach you. But a lot of my de-escalation tactics is based off my relativity, my observation, and my prior lived experience and then growing up in Philadelphia.
So you're uniquely suited, and I think many jurisdictions aren't lucky enough to have an Antonio, but you are uniquely suited to be able to have that understanding and being able to relate to them, but you also have such a short time to engage with them, right? I mean, and maybe you could tell folks a little bit about the Accelerated Misdemeanor Program. But it's a short-term, 90-day intervention to address the mental health needs of folks. And so tell us, what is realistic when it comes to the mental health population who have trauma histories and substance use that you mentioned? What is realistic in such a short amount of time?
What's realistic is you have to be very careful because we have to also remember that these clients and defendants, these guys, they have to go home. They're going home right after the court. So I'm very conscious of how much information I extract from them in such a short period of time because they're going back out into public transportation, and they're taking these emotions back out with them. So I'm very selective to the individual as to how much information I pull, how much of your trauma history do I pull out you within the span of 7 to 15 minutes max. And it's a skill, but also it narrows back down to relativity and customer service. these, you know, people just want to be made whole. Yes, some people are there to, because they did just wake up and say, you know what, I just feel like doing X, Y, and Z today. But for the most part, I understand that, you know, coming from most of our districts, all of our districts are in impoverished, most of the highest impoverished areas in Philadelphia. So understanding the makeup of Philadelphia, I understand that these guys, many of these guys did not start, they didn't start with the most glorious life. And this, you know, a lot of things that they may have went through went unaddressed for years. I try and hone into that, and that's what I target, and, you know, that's when I sit there and, you know, make those recommendations for them to go seek mental health.
So I think that's an interesting point you're making also, particularly about being very careful to not extract too much information and kind of recognizing that your role as this kind of liaison with the client and getting their buy-in and getting their trust and engaging with them, but also being that connector to the community services or to community-based services, and kind of pulling out the just as much information that you need to make that connection. How do voluntary services play a role in the work that you're doing, and why is that important for this population?
Number one, there's a stigma around mental health. People use the term, I don't like to use the term crazy, but under this circumstances, I want to use it. And within the African American population, there's this thing, I don't want to be perceived as X, Y, and Z. So a lot of people will forego getting those services. So, you know, if part of my buy-in is, hey, listen, you know, every 6 months I sit down with my therapist because, you know, which is my cats, but I sit down with my therapist, you know, it brings out, you know, are you serious? You know, it helps. It really, really helps, and it makes a world of a difference to a lot of these guys, especially the young African-American guys that understand that, you know, I don't want to be perceived as this bad person that's on these medications, et cetera, but a lot of guys that come into our program, they've just been misdiagnosed or undiagnosed for years. So I don't know if that quite answered the question.
Voluntary services, but yeah,
Voluntary
but
services.
The need to.
Well, to get back to that, and I do apologize. The voluntary services with AMP is a voluntary program. When a client enters into is offered the program normally is designed to last anywhere from up to 4 months. Sometimes, as I told you outside, that part of their requirements are to bring back proof of treatment. Many come in, the dog ate my homework. We have to, you know, reschedule the court date, and then we have many instances where people just flow right through and do what they're assigned, and they'll say, hey, listen, thank you very much for, you know, stepping in. I needed that, and it works for me. The program has been very successful over the past year plus. We are seeing a lot of progress that we're proud of, and we still have a lot of work to do.
So, okay, so we've talked about trauma and kind of understanding why it's relevant to this population and how trauma is intersected with the mental health and the substance use population. And in the courtroom, we see how trauma reactions actually play out, and the need for kind of recognizing that we're dealing with low-level cases. Short-term intervention is kind of all we've got. How do we make the most of it? Let's connect them to services in the community to be able to kind of continue that journey of addressing those issues once the court case is finished. So Laverne, let's bring you into the conversation. I didn't forget you all the way over there. So what exactly is the peer advocate model? And why, or I guess how does that model, how can that model help us understand and address the needs of this population?
Okay, well, I think the peer advocate model is kind of, you know, when I think about it, what it is that there are many different definitions of, definitions. So when I look at kind of peers involved in the criminal justice system who are providing services. Generally, they're called peer specialists, mentors. Mentors. I feel like Diana Ross. Mentors or peer specialists or recovery coaches. And so, first of all, I think I'd like to talk about who is a peer. Within the context of my work, a peer is a person that's had a criminal justice experience in the criminal justice system, as well as a behavioral health challenge. And it's really important in criminal justice settings, treatment courts, community courts, that peers have those experiences, because otherwise they can't assist the individual who's involved in the court through their recovery journey. And so I was just sitting here thinking about how the whole peer advocate and the peer specialist role has really expanded. When I started Howie the Hart Peer Advocacy Center, I was taking a train with one of the directors at the New York State Office of Mental Health. And I believe strongly that folks want to work and they should be able to work. So I viewed the work that I was doing in training peers with criminal justice histories to work in human services in general as a workforce and development issue. When you're dealing with state government, workforce initiatives, I think they get and they understand. And so it was so the idea was basically to really train peers to work in a variety of criminal justice settings, to provide internships where they would get on-the-job experience, because most of the folks that that came to the training were not, had very little job experience. Some were on parole, some were on probation, some were coming from treatment courts. And so it was really about creating an environment where folks could really learn. And so when I looked at the states that are represented here, several of your states have peer specialist training programs. Really, there are, I think with the exception of California and some of the territories, most of you have state-certified peer specialist training programs. And unfortunately, what's happened is peers with criminal justice involvement, because the demand for the trainings are very high and there's a great deal of discrimination and stigma that even though that peers in general, people with lived experience have towards folks who, with criminal justice history. So they really don't have access to those trainings. But you have several states like Michigan, Georgia, New Jersey, Washington State, San Francisco, Miami, Portland, Oregon, that have added either as a separate training or an additional training module or continuing education training for training that's geared towards, it's called forensic peer specialist training, but I try to get away from the terminology of forensic because that has a meaning in psychology. But it's really to train peers with criminal justice histories to work in various settings. The Gaines Center developed the sequential intercept model, which goes from 0, which is in the community and no law enforcement involvement, to 7, which is reentry into the community. So peers are really working in a wide variety of settings, whether it's providing reentry services, whether it's partnering with community supervision, whether it's doing CIT, crisis intervention teams, jails. So they're doing a whole bunch of work. And in the past 10 years, it's really, I would say to my surprise, and to some extent, it's really, it's expanded. And part of that is the buy-in that we've had from law enforcement, police, because they don't want to arrest somebody. They would rather bring somebody, if someone's assessed, where do they go next? And most police officers really want to have a place where they can drop somebody off and know that that person is reasonably going to be taken care of. And so it's, and jail involvement, although it's a short turnaround period of time, a lot of individuals spend a lot of time in detention because of their mental illness and substance use. They're either, waiting competency hearings or any number of things, or unable to cooperate in their defense. So peers are able really to, in many different criminal justice settings, to really play really key roles, particularly around trauma. And I don't know if you're going to ask me. Mm-hmm.
So I think that's a really interesting point, but that recognizing that the peer advocate or the peer support can not just help communicate and support have a shared experience of the lived experience of having gone through the system and having a trauma history or a mental health issue of the person that is coming through your courthouses, but that they can also be that bridge in kind of communication and helping us as practitioners understand, oh, they're yelling not because they're mad. Like, that's a trauma reaction that you're seeing. Like, they can kind of help us interpret some of the characteristics or the symptoms that Kenton talked about that we're seeing in the courtroom. I think, or I'm kind of anticipating that a lot of people in this room, and certainly before you and I have gotten to talk, myself included, had this kind of misconception or this assumption that hiring formerly incarcerated people to work with clients in the system will kind of help those clients further scam the system, so to speak. So, I don't know, talk to us about that.
Yeah, I've heard that. I think they use the term lingering or other pejorative terms. The bottom line, when you look at states that are really implementing these kinds of programs, whether we're talking about treatment courts, treatment court collaboratives, community courts, the peers working in those fields are less likely to get involved in criminal behavior than the chronically normal. And that's because of several reasons. Number one is because most folks are given really extensive training, so they know about some of the informal and formal rules of, let's say, corrections or what have you. And so the training is really important. I never forget, I was working with someone that was providing discharge planning at Rikers Island, and he thought it was okay to bring a T-shirt and some cigarettes to an inmate that he was providing services to. And, well, he was banned, he was actually banned from going on the island again. And he didn't understand. He was trying to help someone, And so it's really important that peers really be trained, again, formal and informal rules, because it's my experience in the criminal justice system, particularly as a prosecutor, is that there are rules, regulations, and other kinds of things that are in black and white, and there are other things that through tradition and history really impact on the work that peers are doing.
Matt.
So, yeah, folks, and so typically people are, because of we all know, I don't like using the term collateral consequences, because it's direct consequences, and people, when you think about, we give everybody procedural justice, which is what I did as an ADA, but we don't give people substantive justice. That means we really don't talk about restorative justice and really giving a person the opportunity to live a life in the community. And when individuals work, it addresses any number of things. First of all, there's family reunification. People feel a part of the community that they work with, that they're working. They're able to live independently, get housing, to have their civil rights, have their rights restored, really to enjoy all the benefits of citizenship that we all do. And it really changes a person's perspective. People have hope, people want families, people have aspirations, and really do look more optimistically about their future. Because one of the things, in closing, is that I found in my work, the vast majority of individuals I work with are grieving. They have lost, and I can identify with it, They have lost years of their life. They have lost loved ones. They have lost status in the community. They have maybe been traumatized. They have sustained losses, and most programs don't talk about loss.
Yeah.
And I'm a fan of Elizabeth Kubler-Ross, that basically you have to acknowledge it, and then you have to work folks through those steps of acceptance. But in the meantime, if those things are not really addressed, then an individual is currently always in crises.
So it's a really valid point in terms of not just having a peer be part of the process to help the clients that are actively engaged in the justice system in the moment, but it's also about helping to rebuild the lives of the peer that has a history. So, and Antonio, I know you wanted to say something.
Yes, I just want to touch on something, is that when people see people from the past that have made a difference, I don't advocate for everybody to go get $100,000+ in student loan debt to sit there, but I had a different goal in mind when I left prison. However, when you give a person a chance, you give a man a job, he will work. You give a person a chance, he will rebuild himself. And when we're looking at models, most people are visual learners. They will learn based off of the acts of someone else. So when they see someone that was formerly incarcerated and see the strides that they're making in their lives, they're more susceptible to follow that pattern. It's the research, the data is all there. It just has to be put out. The point that you made about some people making mistakes going into the prisons, I kind of never really ran into that situation with our peers, but you know, even to this day, it's been 24 years since my conviction. I'm still asked about it, regardless of all my credentials. I'm still asked about what happened in 1987. Well, what happened in 1987, I was hungry, I had to feed my family, and I sold drugs, unfortunately. And I'm paying a heavy price for it. It's a life sentence. So, you know, but the only difference now is that I do have the credentials to say, you know what, at this point, I don't think that you deserve me being at your table or your organization if you're asking me something about what happened 30 years ago. So at what point is enough enough? And we need to, we as practitioners need to take a very broad look at that to say, okay, you know, it was a point in time in history when, you know, I guess the slogan was, you did your time, let's move on with life. We're giving people life sentences.
Yeah, no, thank you, Antonio, that's a really valid, yeah.
Yeah, I think you're spot on about, you know, those experiences, but I think, you know, most peers are wonderful in asking people what happened to you. They also are in a position to engender trust. You know, folks have a real in many communities, we don't even have a language for trauma. People will talk about when you're subjected to, you know, to community trauma and other kinds of things in life, you think that that's the norm. So the peer can really help the person, you know, an inmate or what have you, kind of understand, look at life through a trauma lens.
So that's such a valid point, and I want to bring Kenton back in to like help connect the dots a little bit more about trauma and the community aspect of it, and then we're going to open it up to questions because we're almost out of time. So start thinking.
Okay, so you guys both brought up some really interesting things. So I feel the strength of peer models, working with people who have similar experiences and are currently going through it, is you're able, when it comes to trauma, one of the biggest factors in being able to kind of channel, survive, get through it, is being able to channel your resilience. So having someone that is there, that's walking with you through the process and actually helping point out some of the strengths that you actually have, right? So when you've dealt with some sort of trauma, whether it's community, institutional, you know, individual traumatic reactions, you look at life very black and white, right? Nothing in the middle. It's friend or foe. It's, you know, up or down, right? So because of that, you unfortunately don't get to think about all the other strengths that you have. You are constantly in this crisis mode. Something's going to happen or something's not going to happen. And having a peer walking you through this is really beneficial because then they're able to highlight the fact, you know what? You had something happen to you, but you still made it to this office. You still called me, right? It's in the social work field, we take a strengths-based perspective. And for us, it's really, in peers, I see it every day at the Crown Heights Community Mediation Center working with the SR Cure Violence teams, where they are literally channeling the resilience of the participants that come through their doors, that they're walking within the community day in and day out, when they themselves are in crises. So I think one of the biggest things when it comes to mental health and the court system and, doing our community-based work is we all have to channel the person in front of us, their own internal resilience, because that is what's going to get them through. It's not going. It may be the evidence-based model that you're using in clinic is going to be great and all, but if you can't channel their resilience, you're not going to get anywhere.
So this idea that resiliency, everyone has it. We've all been through things, and that it's part of our role maybe as practitioners in this field is to tap into identifying how somebody is resilient, what skills do they have that has helped them become resilient, and that the peer element of that is a resource for folks.
Definitely, and it's like, channeling that resilience can be done from the clinician, could be done from that peer that's walking the street with them, So understanding that we have to work with our client and figure out where's the entry point, right? And that is I feel like that's the beauty of having peer models working alongside clinical work and case management. And if we're able to kind of communicate effectively, then we're actually able to kind of provide thoughtful and supportive services to people that are navigating these systems that do cause harm.
So I have a million more questions, but I won't hog the microphone. Who here wants to ask a question? We're going to open it up right now. No one? Okay, Judge Logan. My colleague John is on his way over with the microphone.
So I'm curious about this peer specialist training. You said there's state training, and you mentioned my state, and this is the first I've heard of it, but maybe I know it under a different name or something. Can you elaborate a little bit on that, please?
What state are you?
Sorry, Washington.
Yeah. Well, you have a wonderful peer-run organization called Consumer Voices Are Born, and there are a few different places, and they do training. Right now, they're doing extensive training, really working with CIT teams, but also mobile crisis teams, and they've actively really recruited, taking a very proactive stance in recruiting individuals with criminal justice histories to provide any number of services for folks. But I can give you more detailed information. We'll exchange cards, and because CVAB is what I call them. They've done a fantastic job. They're like a one-stop shop. You're welcome.
Up here, John.
I just want to say in San Francisco, we funded our peer mentor training with a SAMHSA grant. So if anybody's interested in getting funding for peer mentors, SAMHSA does fund this.
Thank you, Allison. then
And I
John, think
provide
there's a
technical
question.
assistance to that project. It's great, it's wonderful.
Good morning. Can you just tell me what exists now in New Jersey?
Well, you have a program in New Jersey that really works with individuals, and I forget the name of it because I just did a presentation. I will get that for you.
Okay.
That really goes into the prison and provides peer support, but most importantly, helps folks re-enter the community and really provide services. I can give you the name of the woman who actually runs it. It's really innovative because it utilizes peers, but there's a very, very heavy emphasis on bringing community-based providers inside the walls and supporting folks so that once they are back in the community, that it's a smooth transition, a smooth handoff, in other words. But you're welcome. I can give you her name as soon as we get down.
Any other questions? John.
Middle's really busy today.
Okay, yeah. Hi, my name is Kim. I'm a magistrate in Cleveland Municipal Court. And one of the gentlemen mentioned about defendants that come in high to court, and I've had that happen, and it's very uncomfortable. because you're not quite sure what to do for the person. They're not really being compliant. You wanted them to abstain from alcohol, go to the treatment program or whatever, and they're not doing it, and they keep coming back, under the influence, but you don't want to jail them. So my question is, when someone comes in with that, what motivates it? I know there's a substance abuse problem, but what is it that they don't want to go and get treatment, or they refuse and they want to go back to the street? The guy kept insisting, he was homeless even. I want to go back, and I was like, we want to help you. It seems like a losing battle. I don't know.
Unfortunately, addiction is a monster that is going to continuously be researched. When a person is just simply not ready, we just as practitioners have to accept that. We have to accept that this person is not ready. Jail is not the answer, because when they wake up from that stupor or, under the influence, they like, wow, where am I at? We feel guilty for incarcerating them, only because, but we, again, to go all the way back to the beginning of the problem. The court personnel does not have the ability to sit there and figure this all out during the course of an 8-hour day. However, my recommendation is to work with the court staff, continue to work with, your court staff, have the individual removed from the courtroom until they're coherent enough to at least understand that they're in court, that you're disrespecting the courts. But, the simplistics of it is that society just has to understand that, addiction, if you're not ready, you're not ready. And I hope that answered your question honestly.
Can I? Okay, good. I mean, I endorse the harm reduction model because I really think, some folks are not really going to abstain. And if they don't abstain, should we then not provide them with services and support? But with the harm reduction model, folks are really exposed to sobriety and what recovery looks, tastes, and smells like. And one of the things I've seen really work really well was I did a site visit to one of the treatment collaboratives in Portland, Oregon. And what the judge does is the judge calls the calendar, and really for folks that are having challenges or newbies in the mental health or veterans court, they watch the judge call the calendar. They hear the judge provide the positive reinforcement. And that in of itself can really be a motivating force for someone who's really struggling with their sobriety. Or even, with their mental illness. It really is about, I endorse what Antonio said.
Yeah. I'm gonna give Kenton the last word, and then we're unfortunately gonna have to wrap up, but go ahead.
Okay, so when I think of substance abuse in the court, I've worked in the courts for a number of years prior to coming here, and I always, the time sensitiveness of, okay, you got to be clean, and I've had a 25-year addiction, and so initially I'm thinking, these things are layered, right? I'm thinking, what are you running from? What is it what are you masking with this substance use, right? So now I then tell you need to be clean because you're not complying. So now maybe I'm clean, but I'm opening up a whole bunch of other wounds that I am not prepared to handle right now. And we have to keep that at the forefront when we're talking about, okay, what's your sobriety look like? How do we support you in this space? Because if jail is not the answer, but you're just walking through these walls, I've got to understand the entire experience. You're using drugs, and that's not something we want you to do, but what does it look like if you're sober?
Complex. And I know we just scratched the surface. Join me in thanking our incredible panelists. Thank you guys. Great conversation.